Okay, Jeff.
All right. Thank you very much. I'm Jeff from Teens4Teens Help. My wife couldn't make it today. She's a better speaker than I am. Um, we founded Teens4Teens Help after a 4.5 year journey, mental health crisis with our daughter and her family. And at the end of that, her story saved another teen's life. And we kind of went, what about all the other teens who aren't lucky enough to have somebody come to their school and talk to them about their problem? And so we asked our daughter if we made this online platform where teens everywhere could hear stories of recovery, get information, and find resources if that would be a good thing. And she simply said it would have saved her years of suffering. So with that, we were kind of all in. And I'm going to show you a clip from a news station in LA about this with my daughter talking. And then I'm going to walk you through the website so you can see. It's a resource that I think you and your team could really use. It's free. Our mission is very simple. It's just to help teens find hope, health, and recovery from mental health and emotional challenges. So with that, let me just start this 2-minute clip. If you can see it. Do you see the news guy?
Yeah.
Okay, I'm going to play it now.
It's not easy being a teen, and these days threats to their mental health come from many angles. Some teens who have faced mental health challenges are now using their experience to help others. Circle of Health reporter Denise Sador has details.
I felt like I was really isolated and alone.
When Kara was in high school, she was losing her battle with anorexia.
I was at a very low weight and I had specific plans to kill myself.
Her parents had no idea how low Kara had sunk until it was almost too late.
I kind of blamed them for some of my problems, and I didn't want to be honest about them with anything.
And we were flailing. We were told that our daughter had to go into a residential program immediately for her eating disorder, and we just didn't know where to go.
Looking back, Kara says hearing a peer who understood how she felt reached her, so she decided to be that person for others.
I spoke at this school, and a student came up to me and told me that he had been suicidal, but my story encouraged him to seek help.
That encounter inspired Kara and her parents to create a safe digital space for teens where they can have access to mental health peer support, expertise, and resources all in one place. Teens4teenshelp.org has a core message for young people struggling.
We need to get rid of the stigma related around mental health issues. Mental health and physical health are all part of who we are, and it needs to be addressed, and it's okay to be addressed.
Teens in this generation spend a lot of time on social media platforms watching videos of other kids. This website keys in on that phenomenon because they know this is how kids connect.
A lot of people are scared to talk to other people, and so they'd rather have that kind of less personal experience of just watching someone else.
I don't want anyone ever feeling alone like I did.
Alyssa's story of recovery from depression and anxiety is also available online 24/7. She and Kara are part of the site's teen board, an experience that helps her grow.
I used to be really, really shy about it and not talk about it, but I know that it's helping others.
Professional therapists review all the materials. The website has connected with thousands of young people worldwide in 55 countries.
I do expect us to grow and definitely become a viral movement.
Okay, let me get rid of that. Stop the share for a minute. And so that just is kind of like how we started. And I'm going to kind of walk you through the website so you can see the resources and see what we do. It's 70 countries now. Everything that goes on our website is approved by a board of professional mental health professionals. It's called our Professional Advisory Board. And it also has to be approved by our youth board, because if the teens don't like it, there's no reason for us to put it up there. And that's really the secret sauce of what we do, is that, we know that teens listen best to other teens. It's part of the reason our daughter recovered. And so with that, let me just share the site and walk you through it, and then I'll open it up to questions. All right. So do you see the website now?
Yeah.
Okay. So I'm going to kind of walk you through it. At the very beginning, we have the mental health topics, and these are the topics we have right now. We can add more topics when we have more stories of recovery. But we built a funnel. So basically, it starts off with these stories of recovery, and I'll show you a sample of these in a minute. And they're not coming up because my website is slow here. But we have stories of recovery, and then that's so kids can hear some other kid, how they got through it, what they learned and what they recommend. And then underneath that, we always have the crisis lines, the text lines, the hotlines, so they can be connected immediately on their phone or on their laptop. And then we have animated videos about this information, narrated by a teen. What's the treatment for anxiety? What's anxiety look like in your body? The types, the coping skills, and the treatment. And then underneath that, we have our resources. And we also broke out resources into not category specific, but apps, crash out cards, hotlines, podcasts, support groups, therapy, and website. And we might, if, with your permission, put you on as a resource for therapy. What I'd like to do is just briefly show you a 2-minute clip of the story so you can understand their power. And we always are very careful. We never talk about means. We never talk about any drugs other than alcohol and weed. And we want to keep it safe. We're a how to heal, not a how-to video. So let me stop that share for a minute and then share the story. Okay, so this is just 2 minutes. Do you see the young lady up there?
Possible and recover. I'm Olivia, and this is my story with anxiety and depression.
This is my journey through addiction and recovery.
This is my story of recovery from anorexia nervosa.
Well, my depression really first emerged when I was in 8th grade.
I was sexually abused at the age of 6, and it went on for months.
Growing up, I was very sensitive to loud noises.
I was bullied and picked on and made fun of.
And I started living between 2 different households.
My self-harm escalated to cutting. I became suicidal when I was in 7th grade.
I decided I couldn't do this anymore, and I attempted suicide.
People began to praise the body that I was in, basically put me in the mindset that losing weight is good.
I was slave to this thing that I couldn't control.
I was believing things that weren't real, and I needed help.
This therapist referred me to an early psychosis prevention center, and I ended up getting stitches for self-harm, which sent me into the psych ward. For about 4.5 years, I resisted treatment. I had relapsed so far that I needed to be hospitalized.
They put me in the back of the ambulance, and on the way to the hospital, to the ER, I experienced several grand mal seizures.
I didn't want to be held captive by anxiety and depression anymore.
It's like, don't be afraid to reach out to other people and other friends your age, and don't be afraid to show other people that you're there for them.
Recovery is possible, and recovery is always worth it.
I wouldn't change a single thing because they have all led me here.
It's a journey, and you're not alone. And there are so many incredible stories and resources on this website that I really encourage you to check out. And I really wish you well.
And remember, there is hope, so do not give up.
Okay, that's that one. And all right, so any questions about that before I show you the rest of the website?
Any questions? I think we're good. Go ahead.
All right, then let me share this one last time and walk you through the rest of this. Where did it go? Hang on a second. I want this to be on my screen. So, oh, there it is. Okay. All right. So this is the website again. Do you see it?
No, we're seeing your desktop right now.
Well, that's not what I want. Okay, so let's try this one more time. Okay. Going to share again. There it is. Okay. Now do you see
Yes.
this? Okay, so I've moved from resources, which is where we left off, to self-help. And under self-help, we have lots and lots of stuff. We have coping skills, which are these categories. They're demonstrated by teens. So, and for whatever reason, my internet is not showing these, so I apologize. I don't understand why. But so they're breathing techniques and grounding techniques, art projects, and all those sorts of things. There's also books and games that teens recommend, and how to start a mental health club, and mental health tips that are videos by young people, and notes of encouragement. Also, playlist, how to make a playlist if you need to relax, if you need to get going, if you need to study. And then we have self-guided support. And this is from Northwestern's Lab for Scalable Mental Health. This is the only kind of treatment that we, treatment that we have on the website. These are single session interventions and they're online. And their research shows that if you had 12 hours of treatment for depression, you'd get about a 60% improvement in your symptoms. And that if you do one of these walkthroughs, you get a 40% improvement, and you can do it as many times as you want, and it's free, and it's always there for you. And then we have videos that our youth boards have picked out from YouTube and other mental health places. And then one of our youth board members created something called Teens4Teens, which is how to make your own mental health portable toolkit. And it's an art project as well. And I just don't understand why I'm offline. So I just really apologize about that. I suppose if you look on your phone or your laptop, it may come up. The other thing that we have that's really underutilized, which is wonderful, is we have something called Teen Talks. And this is where teens interview mental health professionals on topics that they're interested in. For instance, here's one about obsessive compulsive disorder, and here's one about body positivity. This one is how to talk to somebody who's struggling, which we did with a young person and a teacher from Teen Line, and it's amazing. College admission stress with a 30-year college admission person. This is really good for teens to hear. It's really good for parents to hear. Superpowers of sleep, school and sports stress, digital life balance with Dr. Jay Farber from the MN Clinic, which of course kids really need to understand how to balance their technology and screen time. Anyways, there's tons of these. These are all like 40, 50-minute TED Talks. And then we also have something called Therapy Explained, where kids interview mental health professionals about what is psychodynamic therapy or EMDR or motivational interviewing. And then in the About Us, we have our story, our youth board. We had a grant with Born This Way Foundation, and we had 30 youth board members at the beginning of last year. And this year now we have 120. We're expecting over 200 by the end of this year. We're going to have to break it up into regions around the United States. We have kids representing 24 different states. And these young people, some of them, have really gone through difficult things and they share their stories. Some of them have had friends who've gone through stuff, or they just want to be involved and help other young people. And one of them Rohan won the Mental Health High School Student of the Year Award last year. And anyways, it's just really fascinating. We have wonderful kids that are doing amazing things. They give presentations in school, they create social media, they create coping skills, they do outreach, they write cards to kids in treatment. This summer, we had two of them go to a treatment center in Oxnard, and they taught them 3 different art projects for their mental health. The Teens4Teens, they made a mantra bracelet, and then they made a personalized stuff-weighted huggy pillows, animal pillows. And the treatment center liked it so much, they hired both of our youth board members. So, and then we just have some other stuff in here. I'm going to show you a testimonial and then show you one other thing, and then we're going to talk. Oh, I can't show you the testimonial. Well, darn it. I will find.
Wow. I mean, I think that like there's so much power in the messenger, and the messenger being the teen themselves who has been through that struggle. And like, I mean, a lot of my healing has not come from like hearing certain things from my therapist. It's come from hearing other stories of former foster youth. I think that there is truly like this powerful magic that happens when you meet somebody who understands some of the pain you've been through and has made it to the other side. So I think that's why there's so much power in this organization, is because it really is one person helping another and saying, look, none of us are well until all of us are well. We are in this together. And I think that there's just this untouchable magic to that.
So that's just, she says it better than I could. And then the other thing we have down here under our merchandise and shop at the very bottom, we've created something called Healthy Coping Skills Toolkits. And these were designed for high school wellness rooms. There's 4 different ones. One is a depression relief box. It says help motivate me. An anxiety relief box, help calm me, a grounding box, and a distraction box. And they have evidence-based materials and all sorts of different things. Some things they can fill out, some they can take pictures of, some they can take home. But it's something we're always trying to get into schools and to treatment centers and to continue to make better and more useful. And so we welcome sharing that with you as well. The other thing we do in the crash out cards, I have, we did this with TMHA. We have one locally, and we've been putting these any place there are teens, and they're simply, instead of crashing out, they reach out and they can use any of these hotlines, text lines with some mental health tips on the back. So with that, I'm going to stop the share and open it up to questions. And here's the one with the TMHA logo on it. And we're all here to do the same thing, help youth and society feel better and be better. Any questions?
Questions, anyone?
No, but what an amazing program. I love the concept of adding the kids into the mix, because I feel like we're always fearful of exposing children to other, anonymity, it's important, all those things, but it's really important to hear from other people that are like us to really understand things. So I applaud you.
Well, thank you. Yeah, I mean, we wouldn't do it without that. And we saw it as a kind of missing piece where we're kind of bridging the gap between suffering and services and fear and education and isolation and connection. We want to funnel them to you. We want to, funnel them to other resources. But this, in the privacy of their own digital space, this is a safe place to start. And sometimes the safe place isn't at home, and it can't be a parent. And so, that's how we are different. And I think we go hand in hand with organizations like yours and TMHA. And we do not pressure anyone to ever share or tell their story. It's, the few that want to, because they've been through something and they want to help somebody else. And actually, the perfect circle for us is one kid had a therapist in North Carolina who found us, and she went on our site and watched some stories, and she was stuck, but the stories motivated her, and she got through treatment and called us up and said, I want to share my story because one of your stories helped me, and I want to help another teen. And that's exactly what we're trying to do, is just have teens help teens, not one-on-one, not, but through video and things that have been approved by mental health professionals. So it is safe and it has been vetted. And we would love to see how we can, work with you, partner with you, be a resource for you, however that works.
Yeah, I just want to let you know, your program, just looking at everything, is really impressive. That took a lot of time and effort and a lot of years to build. I was looking at all your resources and going, hey, that's good for me over here. This is good for everybody. And it also lets us know who are older some of the more unique stuff that our teens are going through, but also relate to stuff like when I was a teen and that kind of stuff. And like also like stuff my mom told me when she was a teen. Like some of this stuff is just kind of a constant, but other stuff is new and constantly changing. So it's good to for teens to say to bring up stuff that maybe I didn't know, you know. So yeah, this is just really impressive. Thank you.
Well, thank you. No, it's been a passion project, obviously, and we wouldn't have done it had we not gone through such a difficult time. And you know, I tell all my adult friends, I didn't know. Nobody taught me about grief. We have a teen talk on grief with a grief expert, right? And you just don't realize it's all these little losses in your life, and they add up. And before long, you're an older person and you're carrying a backpack full of grief behind you, and it's just dragging you down. And so I just tell my adult friends, go watch this teen talk. It's for you. So thank you for that. And thank you all for what you're doing. It's super, super important and it takes a village. Um, I'm sure you're all aware of the book, The Anxious Generation, because, you know, you really, there's a reason why we kind of have this exponential mental health crisis in our country.
Familiar with it. I have seen it pop up on my social media stuff. I am following somebody that does talk about limiting social media, how it's changed for teens since I was on the internet all the time when I was 13. That was 1997. So there wasn't social media, so it's a little bit different now. But there's some similarities, but and there wasn't cell phones, so yeah, it's definitely goes into the fact that we're all connected with the internet, but we're also so isolated, and that was what some of the stuff that I've read really goes into, and how to address that unfettered.
Yeah, it's one of the things we want to get some of our young people to address, although it's kind of like telling them, you know, don't have junk food and you know, don't do the things you like to do and don't do the things that everybody else is doing. And so we haven't really gotten that on there yet. You know, it's not just social media. I mean, it's screen time. So when the average high school kid has 7 hours a day on screens, that's not healthy. You know, it's the opportunity lost to be in person, to have all those developmental, you know, social cues and experiences and failing and learning to be human and getting your self-esteem and confidence. And it's also parents since the 90s bubble wrapping their kids because the news says the world's super dangerous and it's no more dangerous than it was when we're kids, probably safer. But you know, we all think it's worse. And so, you know, all these things add up and it's that technology with the 7 hours of screen time that is just killing us and not getting us enough sleep and not getting us outdoors and not getting us in group. And anyways, that's what the book's about. And there's just more and more evidence of this. And so, you know, by doing what you do in person with teens, that's really, you know, part of the cure, a really important part of the cure. So, any other questions? I'd love to answer. That's what I can do best.
I have a comment, really. But anyway, stuff about the backpack. That's been a philosophy of mine, where you go through life and it's like you're on a nature hike, and you're picking up little things that you like, and over time you're just carrying junk. So it's like, okay, I needed this rope. The rope broke. I'm still carrying it. Why am I still? It's like this rock is really pretty, but it's heavy, and so every now and then we need to sit down, get through our backpack and take things out.
It's a great analogy.
All right.
Congratulations.
Oh, thank you.
Powerful.
We have a question from one of the members or from one of the attendees. Can you see the question, Jen?
Oh, let me, you know what? I don't have my chat up. Let me put it up. Okay, should anxiety, depression, habit providers be replaced with AI? Absolutely not. Let's see. What is the exact question? There seems to be a whole bunch here.
It seems like that person jumped off the call to, so I don't know if we'll get clarification.
Yeah, what is the exact question? I mean, is it just the anxiety with the AI? I mean, I think, you know, we don't know where AI is going, but there was a news article from the Washington Post or whatever, how it did just save a kid's life, how, he was trying to do homework and then mentioned that he was suicidal, and the AI helped him not commit suicide. But AI is also given terrible mental health advice. And the problem is humans need humans. We are animals that are used to being together in tribes, and we haven't evolved out of that. And so we need that. We need the interpersonal connection. We need the, people in our life to be part of it and to be supportive and to be of support to other people. At least that's my opinion.
From everything that I've seen with AI right now, it's positive feedback loop. So it's a similar algorithm to social media. So it's kind of you put it in and it puts it out. So it's really depends on how you use it. And so it's
good or bad.
Yeah.
It seems like a lot of the people who run the algorithms are aware of the ill effects it has, but they seem to sort of don't care. It's a little bit, it's kind of a predatory quality to it.
Absolutely. They're not in it to help human beings. They're in it to make money. One of the examples is, Facebook. And so Facebook knows that the easiest thing to do is to target young girls, right? They can send them a couple of videos about how to have the perfect, body. And then this is how you exercise. And then this is how you diet. And then this is pro anorexia sites. And then they send them down that loop until they die. And they make money off of it. They made, the year my daughter was in treatment for anorexia, they made, $100,000 off of sending young girls to pro anorexia sites. And that's what the algorithm does. It's responsibility, and gaming responsibility for boys and social media for girls is to keep you online. As long as you're online, they make money. And they have the best psychiatrists and the people who know how to do everything in Vegas to keep you putting the slots, keep working the slot machines. They do that with all this technology. And, technology is not bad or good, but if you're ignorant to what it's doing for you, then that's not good. You need to use it for what you want to use it for, not having it use you. And if it's free, we're the product.
That would be a really interesting topic to hear teens talk about. I think teens are waking up to this. I work with young adults more than teens, but the ones that are really on the cusp of like knowing how we're being played. Because I feel like just telling young adults, just telling me as an adult, don't be on it. But that machine's so much smarter than I am. And I think that acknowledging that takes away the like, you are so, lame or lazy or, but knowing that something is really powerful. It's not like I just like going on the internet. I'm literally being fed something that is driving me going back to it. And there's kids that are figuring this out and that can speak to that sort of like it's its own addiction and its own problem and its loneliness and all these things all the things you're speaking of. But it'd be really interesting to hear kids talk about it on top of.
Yeah, I mean, obviously these kids have been exposed to way more than we were as kids, and they're bright. I mean, some of these kids are super smart. We have a youth board member who wrote an article in the New York Times about mental health. And, her ability to write and speak is greater than mine now. And she's 17, 18. So these are, the kids today are very, very bright. And that's why they need to be part of the solution, because they're the best ones to deliver the message.
Yeah, for me, going back from my memory of being a teenager, what was really frustrating is when we talk about teens, sometimes we talk about them like they're little kids. And it can be very patronizing when being a teen is training wheels for being an adult. And even when you're in the young adult, when you're like 23, it's like the training wheels may still partially be still on, depending on who you are in your life experience. So yeah, that's something that I think everybody needs to be in remembering, that it's like, yeah, you're talking to somebody who's pretty much an adult in a lot of ways. The training wheels are on, but that they're there, it's you're an adult pretty much. Like a lot of 16-year-olds that have can do just about anything that a 21-year-old can do. So it's So that's one thing, that just remembering that frustration, that it's like, but also knowing that when I was a teen going, yeah, I'm not quite ready. I still want this treatment.
Yeah, there's times when you're a teen, you think like I know I'm an adult, I can do anything an adult can do. But then like, and when you get to an older adult, you remember like, oh, okay, yeah, I was kind of a kid, thinking like a kid, but even though I felt like an adult, I was still thinking like a kid in a way.
Yeah, it's a transitionary period.
Yeah.
It's tough today, boy.
Yeah, tough today. Very hard today.
All right. Well, that's us.
Thank you, Jeff.
Thank you, Jeff.
Thank you.
Thank you, Jeff. Julie?
Yeah. Yeah, I can join the Zoom or share the.
Yeah, that would be
probably
good.
easiest.
Yeah.
Let me just pull it. Maybe we have a young one here. I'll just join. Good, great idea. I don't know how we didn't think of that ourselves. I know, I was a senior during COVID, so. Yeah, see. I had a senior during COVID. Did you really? Yeah, so I know my ropes around this now, out of, not wanting to.
Your computer system might be a little.
It's the last few days. Something is going on like everywhere I go. Yeah. Slow. My house is so slow.
My house is pretty good. It's in comparison to here. It's slower. It's just like so many computers.
I think that would be far from. We have all the kids living at home right now. Yeah, that's what everyone's got 2 devices. I'm like, our capacity for. That's definitely part of that. My dad's on his own. Okay, the kids are there, right? Awesome.
Oh, do you need to be on? Go ahead and give her host.
Yeah, I think so. Do you need to be on a host to share?
I think I can share without it. Yeah, it's looking like I can.
Yeah.
Okay. All right.
Okay. Awesome. Hi, everybody. I'm Caroline. I am with the Center for Child and Adolescent Mental Health here in San Luis Obispo. We also have a location in Santa Cruz, but I'll be focusing more on what we do in this community here because they function a little differently than us. But at the end of the day, we're all one team. Right, so this is a little picture of the top of our treatment center in SLO. If you guys are familiar with the area, we're right next to Bravo Pediatrics. There's actually like a pediatric doctor's office, then us, pediatric psych office, and then a pediatric dentist, all in one lot. So there's a lot of kids running around. It's a lot of fun. Yeah, so that's us. We're on South Higuera, kind of near 40 Prado, like right down the street from them. All right, so about us, our mission statement is that we exist to expand access to quality, evidence-based youth mental health care as quickly as possible. And then our vision is a future where every young person can quickly access effective mental health care and grow with confidence and resilience. And then we work with anyone under 26 years old. So young adults, teens, adolescents, even younger, depending on different situations. I think we have as young as like 6 years old. So we have a wide array of ages, and that definitely needs for different therapists, different techniques, different types of therapy. So it's a awesome mission. And right now we have about 50 families in San Luis Obispo between all our clinicians. And frequent times we'll work with like siblings. Just depends on the situation and what the family needs. So this is a little photo of our team. Carrie here in the top corner, she's our treatment coordinator. So me and her are the only ones in the San Luis Obispo office who actually aren't clinicians. We're doing all the background stuff. And then everyone else pictured here are amazing mental health clinicians who are either social workers, licensed clinical psychologists. We have some marriage and family therapists, some with PhDs, some with psychology doctorates. So a really wide range of experience and different, backgrounds of education on our team, which has been awesome and
so amazing. But these are all of our slow people. I'm sure you might recognize some faces, but Dr. Ramona Friedman up there in the center, she's our CEO and founder, and she has been in the area for about 15 years now. She has a PhD, and her husband's actually Dr. Josh Greco, who also has background in clinical psych. So they're kind of the power couple leading us all through this newer nonprofit. Okay, and then a little bit about our treatment center. As I mentioned, we specialize in evidence-based treatments, and we start off with a full assessment. So we want to make sure, even if they've had any diagnoses in the past, that we're kind of reiterating that diagnosis. And then our main focuses are anxiety disorders. We do a lot of OCD, depression, immune disorders, attention deficit behavioral disorders, and we also focus a little bit on trauma. And then up here to the side are just all of the types of therapies we offer. So probably the most common one is CBT, cognitive behavioral therapy, has huge benefits for all ages, adults, young adults, everyone. And we also do dialectical behavioral therapy, which is a little bit more for borderline personality disorder, self-harm, suicidal ideation. ERP, our exposure response prevention, is a really, really popular one for kiddos with different phobias and OCD. So that kind of, like, for example, we had a kid who was terrified of throwing up. So what the therapist did in that situation was bring him to the bathroom and act like you're throwing up in the toilet. So that's kind of that exposure response type of therapy technique. And then we also do acceptance and commitment therapy. And probably our most common is family-based treatment. We work with the parents, we work with the siblings, we work with anyone who is a caregiver for the child. We know that just treating the child isn't necessarily the best route to go when a lot of stresses come from the family as well. So we have a lot of parent meetings. Parents are always in the treatment rooms with their kids, but we always do give the kid the option to include them, which is incredibly important. And then we actually are also starting up a few support groups this upcoming fall as well. So we'll have a teen girl group led by one of our newer clinicians, Chrissy Kroll. She just graduated her associate program, and now she's kind of working towards her hours to get licensed. So that's going to be in person in San Luis Obispo. And then we also have a young adult group, which is going to be on Zoom. And that one is led by Danielle. She is a new mom and also an associate level clinician. So that one works a little bit better virtually. So yeah, those are both upcoming, which we're really excited about, and both just amazing clinicians for young women and teens to get advice from and work with. Yeah. So not only are we therapy-based, we also are basically a school, as Ramona likes to say. She does very, very, very close supervision with all of our clinicians. And along with that, they also do clinical fundamentals each week where they meet for a couple hours, go over their whole caseload, and talk about different therapies with one another. And not only does this include just like talking with other clinicians, but they also travel to a lot of research conferences. This was this past spring in Las Vegas, the Anxiety and Depression Association of America. All our clinicians went, and they got to hear of the newest type of therapy techniques and learn from researchers. It was a really awesome experience. So we always like to say, not only a therapy place, we're also a school for future therapists, training them in the best evidence-based practices so they can help out their patients as much as possible. Okay, and then so for this nonprofit, we wear a lot of hats in it. We have a treatment center, we also have a parent center, and we have a teen center. So our parent center is really focused on parent education. We have a monthly parent drop-in session that happens on the last Wednesday, 5:30 p.m. It is a very laid-back environment where parents can hop on and ask any sorts of mental health questions to a mental health professional. It's free. We have the option for those to be confidential and anonymous. You can just join the Zoom, no camera, fake name. For all we know, we won't know who you are. Send the message in the chat. We won't hear your voice. So it's really great because it does give that option for anonymity while also giving the option to connect parent to parent if that is what the parent desires. And then we also give parents the ability to submit questions ahead of time so that our clinicians can kind of look at what we're talking about that session, look at who's asking, what ages we're looking at. So that's a really awesome component as well. And then the past few drop-ins, we've had some specific themes. We've noticed that parents are more likely almost to join if there's a topic presented rather than if it's kind of like an informal Q&A. It seems a little bit less, I guess it's less apprehensive if you're just joining and you know maybe, oh, you're just going to sit and listen to something. So we had a deep dive into youth ADHD and autism with Dr. Tammy Dobbs, which was extremely important to be talking about right now. And also was just, she's a great clinician here in San Luis Obispo, works with a lot of kids. And then just this past August, we had navigating back to school stress with our president of this Santa Cruz, Dr. Lori Butterworth. So that was also very important. There's a lot of school attending anxiety and kids just not going because they really don't want to. So we talked about how to just gradually get them there, you know, first day, maybe just drive to the parking lot. Second day, get out of the car in the parking lot, just little tools like that that parents could utilize if they are in that situation. And then very exciting, we are collaborating with Laguna Middle School here in San Luis Obispo this upcoming school year. So their PTA has collaborated with us to offer 2 different mental health programmings each month. So the first Thursday of the month is a parenting workshop where we go in person to the middle school. And this last week, we did a presentation on stress and anxiety. So that's kind of what the kind of kickoff was about. And then we're also going to do a Laguna Middle School specific parent drop-in where it'll just be open to those parents. And that's going to be on Zoom the 3rd Thursdays of the month. And then next month, our topic is raising kids with healthy motivation in a toxic achievement culture. So talking more about, I'm like, yeah, it's a good one.
I mean, that's, so a little bit about me.
Yeah.
I have chronic illness and pain, so it's, I definitely feel that, like, feeling like society values you more and you're seen more as worthy if you do more.
Yeah, most definitely.
And you have to be accomplished and great at doing that thing.
Right.
And then there's the fear and the pressure that it must be perfect the first time.
Exactly. No, yeah, I know. You know exactly what it's all about. And parents especially are grappling with, how do I motivate my kid to the facts? Obviously, we want our kids to achieve, get good grades, do the work, but where's the point where that's too much? So I worked with a lot of high school students this past year at Rio Grande, and most of them were going through college applications and just grappling with how stressful that is. And this is a middle school presentation, and we're already talking about it. So it comes up early. So yeah, this is going to be by one of our clinicians, Dr. Kathleen McMahon. She actually started off as one of the student affairs big people at Cal Poly, and then she decided to dedicate the rest of her career to her degree in social work. So she's now one of the clinicians with us. But coming from an academic perspective, she has a really good understanding of what this culture looks like in, the college. So we're really excited to see how the parents enjoy that conversation. But we're really excited for this program. It's been a dream of ours to just be hired by different schools to offer these. It's really hard to get in contact with the schools in San Luis Obispo. Near to impossible. So the fact that they're seeking out these resources and we can be here to, share our expertise has been fantastic. And the parents are seeming to really like it thus far. We've only had one session, but it was a great turnout. And then 50% or so of the school is also Spanish speaking. So we also offer all the resources in Spanish, and we have a Spanish speaking clinician there during all of the workshops so that we're getting all the information to everybody.
And we did have some months back Central Coast Autism.
Yeah.
So so it was interesting to see that you've talked about that as well. So it's nice to just
yes, definitely. We have a wide arc of different kids and different backgrounds and different treatments that go along with it. So yeah, there's a lot going on, but autism specifically is a really
And I'm
interesting
glad that
topic
you
right
know
now.
about them too, because it's, that's one thing why we're doing these meetings is so that everybody kind of has an idea of everybody else exists.
Exactly.
That's a big problem.
Totally, yeah, thank you for adding that. So along with our parent center, we also have our teen center. Jeff, I think this goes along greatly with what you were chatting about. So we have every year we do a program called TAG, which is our Teen Advisory Group Research Program, and they practice a research called Youth Participatory Action Research, which is practically just we give the youth what we want them to do, and they come back to us with how they want the survey questions to be formatted, what they think like good answer choices would be, because at the end of the day, they are the experts in what they need and what their peers need. So we worked with Rio Grande High School, Slow High, and Mission Prep. We had, I want to say it was about 30 kids total in our TAG group. And I worked the Rio Grande crew, so I went down there pretty much every week and we met. We would talk about research methodology, just talk about what they think their school needs, it was a group of girls, so yeah, it was really cool. We talked a lot about male versus female mental health and how it presents itself in high school. So it was fabulous. But our research questions were, what are the major mental health challenges teens in SLO County are facing today? What are the major barriers to teens in SLO County receiving mental health support? And how can SLO County community members and schools help address mental health challenges? So we wrapped up this whole research survey and responses at the end of last year around June. We had our students present at Slow High School to mostly their parents were the ones that showed up, but just giving up the conversation, chatting with what they found and what they think is the best route for their schools. And if you wanted to check out our full report, you can get to it on this QR code, is also on our website. It's a lot of graphs, a lot of research lingo, but you can see how telling these results are into what we put our money towards. Like when Jeff was chatting about the peer-to-peer support, that is actually the main place teens would reach out in a form of crises. We found was peers was number one overwhelmingly, parents number two, and then we kind of called them like anyone else, like maybe, not necessarily a friend, but a friend of a friend. That was number three. So we found that hotlines, for example, clinicians, doctors, those were some of the last people these teens got to when they were looking for help for mental health conditions. So that was really telling in where we put our resources and our money.
That actually doesn't surprise me
Yeah.
that much. Just remembering when I was a teen that even though my mom was saying, yeah, I've been through this, I know what you're talking about. Well, maybe you don't really understand that, right? And so sometimes it is nicer to have somebody that's the same age, like even better that you don't really know very well, a complete stranger at the same age, and just
yeah, totally. Yeah, it was. They were so proud of this, and the group has presented to a few different organizations in the community, CAPSLO's teen group. They presented to actually the group of peer counselors at Slow High, which was a really great opportunity, along with a few others. So yeah, they're a great group of people who are just so dedicated to making, their high school experiences better for the next generation.
And when it comes time to announce those big meetings, go ahead and send us some flyers.
Most definitely, we'll do. Yeah, most definitely. Yeah, now that I know you guys are, advocacy and all of this, I will definitely be sending everything your way. Yeah.
Cool.
Yeah.
Will you do this every year?
Yes. So this year we aren't sure what the funding is just yet, unfortunately, but we are kind of in next few months we'll have more of an idea. I am kind of leaning towards either this program will run or we'll have our youth advisory board back, which was run in 2023, but we took a break last year. So it kind of, unfortunately, as a lot of nonprofits are right now, based on where's the money, where can we put the money, but to be determined. Luckily though, this data is gonna be kind of like analyzed again by me actually in the upcoming months. So we might find some new trends and some new information as we go along. So
Yeah, and this will be great also as years go by to see that trend.
Right. Yeah, and this is like our main focus with this whole research survey is how can we inform the community members what these teens need? You know, how can we tell TMHA, this is what we found, like how can you guys use the same programming? So that's why we keep totally, yeah, college students too. So that's why this report is available, open to the public, you know, completely free to access. And we hope our community members do use it. It's great stuff. Yeah, but then some of our upcoming events, I know we're all getting ready for Journey of Hope. We're so excited to be boothing again this year. So we will be there. We're also going to be at the NAMI walk this upcoming October 4th, coming up. So we'll be boothing there as well.
And I saw your team for the
yeah, awesome. Will you guys be there as well?
I don't know.
Okay.
It's like something that I'd like for us to do.
Yeah.
There being a team. I mentioned it. Don't know if it will happen.
Okay, cool. Well, hopefully it does. And then our CEO Ramona here is also doing a very interesting. I don't even know how to describe it. It's called the pitch. So Must Charities, a local organization, invites a few nonprofits to apply and are chosen. And what they do is Ramona's basically been training for this like a minute and a half pitch for a few months now. And on November 6th, her and a few other nonprofit leaders are going to present to a room of stakeholders. And then there's like a first prize and a second prize winning of grant money. But the main kind of idea around it is let's get our mission out to a bunch of people who have money and are willing to give it to really great causes. So that's where a lot of our focus is at right now, is getting Ramona ready for this very, very exciting presentation that's coming up. It's going to be in Paso on November 6th. Is it public? It is public. You have to buy tickets. But yeah, it's really interesting.
Yeah.
We didn't know it was a thing until we applied. So yeah, it'll be really exciting to see what happens. But there's
Cool.
other
I mean,
really
I know
business
kind of like that what was that shark kind of thing?
Yes,
for businesses kind of thing.
definitely.
It's the same idea, only it's a charity organization.
Exactly.
So cool.
Yeah, and we're the only mental health nonprofit included.
Oh, wow.
So that's why we're kind of like we might be the best,
Yeah,
but
what else matters more?
Yeah, right. It's interesting. It's like a ranking of really great causes, but I think the whole point is how do you deliver your cause? But we're really excited for that. Hopefully we come back with first place winnings, but if not, I'm sure it'll be a great experience no matter what. Yeah, so thank you all so much for listening. Please let me know if you have any questions or if you'd like to join our newsletter, email me at caroline@ccmh.org. We send out a really great newsletter. Well, I guess I'm biased because I made the newsletter, but I think it's really great. Just
I love
updated
your
information.
newsletter. I like to collect all the different newsletters from everybody so
Yeah.
I can have an idea of what's going on.
Appreciate it. Yeah, it's
I have a question.
Yeah, please.
Is it what are fees or how is it self-referral?
Yeah.
How's that entry process?
That's a great question. So we work on a sliding scale for most of our patients. We also offer a super bill for insurances. We do not accept insurance, unfortunately. We are working on Medi-Cal.
Okay.
That is a hard, long process. So our clinicians up in Santa Cruz have Medi-Cal already. So there are some opportunities to do telehealth. We try to stray away from telehealth just because in person is just so much better and so much just more reputable. So yeah, but we try to get those prices as low as possible. The sliding scale really does though unfortunately depend on the grants and where everything is coming in. So yeah, so we work with the family as much as we can.
And can they refer themselves?
Yes,
Okay.
they can refer themselves. Carrie at ccmh.org, she's the one who, I'll put that in the chat too. She's the one who deals with all of our referrals. Right now we do have a bit of a wait list. We also just got another clinician.
Okay.
So, and we offer everything in Spanish and English. We have 2 Spanish speaking clinicians. So yeah, we should be taking more people soon.
Great.
I know they all just turned up a few extra people in their caseload though, so it might be a little bit of a wait. Thank you. Of course, yeah. Any other questions?
And what would be considered a little bit of a
Yeah, that's a great question. So it really depends on how much our clinicians think they can take on. There are some cases where it's a lot more simple than others. And there's other cases that need a lot of time, a lot of appointments. So it does depend on if their clients they have now are meeting on a weekly basis or more than that or less than that. I would say we try to get people in less than a month.
All right, no, that's fantastic.
Yeah.
I've waited for stuff for a lot longer than that.
Exactly. And it's so unfortunate, but that's our mission statement. We want to get care as fast as possible because the moment someone's reaching out for care, we need to get the care as soon as possible because there's always the chance that they think, you know, a few days later, oh, maybe I don't need it. So yeah, we try to work as fast as we can.
Fantastic. Jeff, anybody else? Do you have any questions?
Sure. I mean, I just wanted to offer, I mean, we've spoken at other treatment centers as parents who've gone through a mental health journey with their daughter. And, if you ever need that for your parent Zoom or something like that, we're available. And, your youth advisory board and ours should probably, kind of interact a little bit. We've done research for, some university stuff where they give the kids a Starbucks card or a Amazon card for their time. And we can, send some of that your way too, if you're interested. So we probably just need to have a full-on conversation at some point.
Yeah, that would be great. I would love to connect with you, Jeff. I think I do have your email as well, so I will send you a new email over and we'll get something scheduled.
Great, great. Yeah, I love what you guys are doing. It's super important.
Thank you. You as well.
All right. I can make sure that both of you have
Great.
each other's emails well.
Fabulous.
Just, that's one of the points of this is make sure, get everybody involved and make sure, really get interaction going. And that helps with more research, more grants, more specialized care.
Yeah, we're more powerful and we collaborate. Yes. Very important.
I have a question.
Yeah.
It's about like the different therapies you have for the kids. I have OCD. That's something that I'm really interested in, and I was wondering like how it would have affected me if I was a kid and had therapy. Because I didn't get therapy until I was like in my 30s, and so I just wonder like how much more effective is it to get therapy at a young age, like for those kind of disorders,
Right.
rather than like waiting decades into your adulthood and stuff.
That's a great question. It's a lot having to, because, all these mental health conditions, the recovery process is lifelong, unfortunately. It's not oh, you're cured type of thing, which I think is something society is grappling with.
Yeah,
as
it's a
is.
winding road,
Exactly.
and not very many people realize that.
Exactly. So I think the main difference there is working with those coping skills earlier on and kind of growing up with those coping skills and also having your parents on board is so important because then they can reinforce how you're reacting to certain things, how maybe if it's a phobia type of thing, what type of situations does the kid, get more aggravated or more worked up. So that's where early intervention is so important because it's just making that recovery process not easier, because I'm not going to say it's never going to be easy, but giving the client more tools to work through that recovery process and strengthening those coping skills so that when they do get to adulthood, maybe they need, who knows, less therapy, less medication, whatever it may be. That is the goal, is just instilling those coping mechanisms into the kids as early as possible. So I would say that's the main difference, although it's not like the disease is ever going to be, completely done with, unfortunately, no matter how early we intervene. It's more of how can we get them to living their healthiest, easiest life at the earliest stage possible. Of course, of course. Thank you for sharing too.
Yeah.
I also want to say, like, congratulations for getting help in your 30s. Like, again, it's one of those things like, we can always look at our past and go, well, it would have been nice if, but it's one of those things like, the best time to start was yesterday, but we have today, and it's better than tomorrow.
Right.
So congratulations on all the work that you've done.
Yes. Yes. Not a huge amount of people don't even get to the point where they're ready to seek help. My background's in public health. I'm currently getting my master's in it, so grappling a lot with help-seeking behaviors. And when people aren't ready to receive the help until they are actually like, oh, I need to fix this. I need to change my behaviors, change my actions so that my mental health condition isn't so debilitating. And we can't treat someone until they're at that point of understanding that they do need to change something.
I think a lot of the things that prevent people from getting help might be like things like shame that they've learned along their journey into adulthood, yeah, maybe things that they could have avoided, getting treated earlier. So it's kind of like, like the things that prevent us can like make things worse exponentially, as we age.
Most definitely, yeah. And stigma probably also rises or lowers with age depending on.
Yeah, depending on the condition.
Yeah.
I'd say overall, it's stigma gets worse as you get older. It's like, why haven't you figured this out, right? And especially like, I'm imagining people who are elderly. It's like, well, you're in your 70s. Why haven't you figured this out, right? It's can be very demeaning, and that can be very isolating, which can lead to depression. And we have a massive problem of depression and isolation with our elderly and seniors. So yeah, so it all kind of intertwines.
Yes.
And it's great to be able to have that help early, and also for those seniors to be able to show the way for those younger people.
Most definitely.
Renee, can I ask a question? Who's with us today?
Oh, sure. Everybody, like, if anybody feels comfortable, go ahead and introduce yourselves.
Well, we have Trista. She's our our
Trista.
director.
Is our boss, our director for this program and a bunch of other programs. Hello, Trista.
Yeah, my name is Trista Ochoa, and I am the program manager for behavioral health navigation, which is peer-based services here at TMHA. And then I am also the program manager for family support services. So our family programs for individuals who have loved ones that are experiencing mental health issues, illnesses, concerns.
Thank you.
Hi, I'm Liberty Massman, and I'm just interning at CCAMH for the summer. And I've grown up in SLO, and like went to SLO High and like most of the schools that we've been working with. So it's been really cool to kind of learn more about them this summer.
Right.
Hi, Liberty, and never just.
Interns, it's important work, and it's a great place, a way to learn. Yeah.
Yes.
And we need you guys.
We do. We were blessed with 3 interns this summer.
Oh.
So I have nothing but amazing things to say about all of the amazing work those girls did, and Liberty continues to do.
Thank you.
All right. I think that's it for introductions, unless if anybody else wants to introduce, otherwise we're good with them.
Yeah, thank you.
If you would like to introduce yourself.
We did it privately. No, I'm Jessica. I own the Decision Bar, and we're a young adult. I'm a life coach for all ages, but mostly I focus on young adults. So mentorship, going through transitions, all that kind of stuff, workshops, and then I do retreats for nonprofits. Deep in nonprofit work forever.
So what is the young adult age group that you're?
Yeah, for me, I started 18 just because I try to stay away from like where I go with the legal 18, and then I go up from there. So if I do group work, like I've worked for CASA and other groups, I'll do group work for teenagers, but in a group setting with other adults and that kind of thing. But when I do one-on-one, I do 18.
And so it's 18.
And I don't have a firm cutoff. I work with kids and adults also, but I would say most of the kids come in around 27, 28. It feels like right after they graduate, there's a real flux, and that's the kids that I find a lot that I'm working with. That doesn't mean there's not other ages, but I feel like that's like the sweet spot.
Yeah, that is really stressful trying to find.
Yeah.
That's the big, like, okay, I spent my entire life at school, and now I'm like really stressed on my big career.
Yeah.
Like, this is what I'm wanting or thinking and wanting to do, then plan to do for years, and now.
Yes. And often the world doesn't react the way you think it will, right? Like in college, you have a very goal that's very, you know what the goal is. You're trying to get out of that. You know, you want great grades, you're, you know, showing to class. Then you get out and it's like, it's really hard to find a job right now. It's a difficult place. We're in a weird flux after 2020 of internships. I'm so happy to hear people are entering again because I feel like a lot of the kids I work with are like, I can't find someone to mentor me. I can't find an internship. So I try to facilitate. Even these kind of groups are great for me because then I can say, well, you know, I heard Jeff and I think he might be able to talk to you about, you know, mental, like I can just, even if it's, and Jeff might say no, but at least connecting people is really important. Part of my work is just knowing what people are doing.
And in my experience, when the answer is, if it is a no, it's like, maybe I can find something.
Yeah.
Or the worst is like, I can't find anything, I'm sorry, but oftentimes there's like, I can refer you to somebody else.
Yes.
That's often how it works. And yeah, I remember, so I have a certificate in 3D animation. And so once I hit, once I graduated, and I was that age, like 27, 28, and it's like, the stress that I put on my demo reel, I never completed it.
Yes.
Yeah. So I'd love to study and do something with it, but yeah. And then I found out later, as with my chronic migraines, it's a little too much for me to work full time. But so yeah, it's just putting so much stress, and then so much stress that it's hard to do.
My favorite thing to work with, because I always refer to mental health providers because I'm not for that. I have my master's, but not in mental, like directly. So I think my sweet spot is the barriers, like those mental, like the self-talk, the like negativity that we put on ourselves, and kids that haven't worked for a year because they're just overwhelmed. And there's one thing that, you know, with most of the clients I see have gone to therapy with, it's kind of an amazing time to be. I don't know. I think there's so much more openness and willingness at your age to go. That wasn't the same for our age. Those of us that are older. But I feel like it's so great. But I think that they still come out sometimes just like unable to like get to the next, you know, take that first step and just like do those little tiny steps. And I love that. I love pushing through those little mind, you know, like tweaking the mindset.
Yeah, and I like to consider myself, so I'm 40. I like to consider myself kind of the transition.
You're in the middle.
Because my mom went to therapy when she was a teenager and through much of her life. And so when she noticed something, I was depressed at 12, put me in. And so I'm grown up with that language and everything. So it's all very easy, fairly easy for me.
Yeah.
And that I'm had therapy. I'm still going to a therapist.
I love therapists. I love therapy.
Yeah,
I'm so glad to hear that.
It's something that I think everybody feels.
Oh, right. Yeah, I'm an aspiring clinician, so I'm really excited, and it is so needed right now.
You'll never be out of work.
No, never. And and AI, it's a job AI can't replace.
No, I agree.
Yeah, and I will say, I know someone asked a question about AI earlier. Interestingly, our clinicians have been using it as a tool. So a really interesting way they have been using it is we have a lot of kids with very specific phobias. So they'll say into like whatever AI platform you use, give me basically a exposure story about whatever situation the kid is scared of. And then they use that and give it to the kid, and the kid can like read it over and over again to get used to it. Just thinking about it, it's definitely terrifying. So that's been something that AI has helped us with. So our clinicians don't have time to write a story depending on some certain things.
I mean, ChatGPT can throw something out.
Right.
Then it does make things a lot easier, and it does bring out that baby step.
Exactly.
I like to consider myself a slow moving ship, or like a big moving big wide truck on a narrow road. Or it takes just kind of I'm just kind of traveling along, and I notice something's wrong, and then I need to slowly move, and that realization is that slowly moving and realizing that I need to move, and so
definitely.
I think a lot of people are like that, where it's a big mindset shift, and it takes time. It's not a nice easy switch, even as much as it seems like we're told that.
Yes. everything should be easy. Everything's so hard. Everything. And we're all so lonely. I think that's, yeah, I think everyone that's putting time into AI can't replace this, right? And we all need each other so much. We need community and so I think it's, getting back to like just getting dirty again.
I think a lot of things, these are still stigmatized, but it seems like therapy has become a lot less stigmatized these days.
Yes, it has. Over the
Become very
past,
popular.
I have noticed the shift, definitely since over the past decades, and really over the past 15 years.
I wonder if it has to do with like TV, all the therapy shows there.
Yeah, it's also oddly enough social media and the way internet culture as a whole discusses things. So I think that's been it.
And I like the Teens4Teens thing, like people talking about it. The more we say we go to therapy, and I've been, and it was so helpful in my marriage, and it was so helpful in raising my own kids, or my kid had a mental health breakdown, my own, like all that lived experience, the more we say it out loud, it's just like shame is something that's in the dark. And as soon as we are not, but we don't have shame, then we all
All right, Jeff, you need to go.
Yeah, I've got another meeting in a couple of minutes, but I just wanted to thank you so much. It was just great to meet you and everybody and continue the conversation. And I'll see you at the event coming up later this month.
Thank you, Jeff. We're tenting together.
Awesome. Great. Oh yeah, you're bringing the tent.
Yes, I'll see you there.
I'll help you set it up.
Great to meet you, Jeff.
Thank you.
Thank you so much. Have a wonderful rest of your day.
Me too.
All right, bye-bye.
Do you guys want to maybe talk a little bit about the future of health coming up?
Yeah. I'm excited.
Yes.
It's gonna be a slow public market?
Yes, it is. Yes, it is this year.
And the sharing tents, are we all sharing tents? Is it like
I don't know. So I don't know too much about it. Just that I need to file out my own volunteer forms. I didn't make it last year, so.
I think I'll be there, but I'm not exactly sure what I'm going to be doing. But
I'll put down. I'm plan on putting down other wherever you want to place.
Yeah.
They do a great job.
They do. They do. Yeah, I think some people are sharing tents.
Yeah.
I don't know if we have or not actually, but
Ours, I'm just like in the middle of the space. I'm like, I can't, in my mind, I have a hard time with that visual. Like the maps, until I get there, I'm like, I don't know what this really looks like.
Yeah, so I can't really say much about that otherwise the flyer does have the schedule, so you have an idea of what that's going to look like. This year there's an emphasis on having teens themselves discuss, and rather than having a presenter, which we've had in the past, just a little something different this year.
yeah. I know one of our tag teams actually is talking.
I
Yeah,
love that.
it's gonna be great. She is so passionate. So we're really excited to have her represent.
Were you there when they spoke last year? The young ones were the ones that were like just so great, like greatest story.
Getting into that crying, like
it was really powerful.
Yeah, it was.
So I guess that's why we're doing that this year.
Good.
So it's I'll be local teens exclusively.
Oh, I love that.
Rather than having a big presenter as well.
Awesome.
So and of course there's I know when times we'll be having like therapy, at least one therapy dog, and I know we've done like some drum circles in the past. Might be one this year too. And of course entertainment, it's different types.
And my favorite coffee shop's right there.
Oh yeah.
That's a really cool place.
Yeah, they did a great job there.
Yeah.
I haven't been there.
Oh, check it out.
Cool.
Really good Thai place.
So yeah, I'll go ahead and volunteer and
eat.
Yeah, definitely.
No, thank you. This is great.
All right. I think then we're about ready to close.